In this video, we are going to talk about obsessive compulsive disorder, OCD. So let's see, what is OCD? OCD is a mental health disorder. It's a lifelong chronic condition in which the symptoms may come and go over time. OCD is characterized by obsession and compulsion, persistent obsession and compulsions. So the symptoms of OCD includes obsessions and compulsions, where obsession is unwanted intrusive thoughts or mental images that can cause intense anxiety in people suffering from them. And these people can't control these thoughts. Some of the common examples of obsession includes fear of coming in contact with any contaminated substances such as germs or dirt, fear of making a mistake, feelings of doubt or disgust, need for neatness and perfection and a certain order, need for constant reassurance, excessive concern with what is right or what is wrong, fear of causing harm to yourself or someone else because you think you're not careful enough. So these are all the examples, some of the examples, common examples of obsession. Compulsion is repetitive actions that you feel like you have to do to ease or get rid of these obsessions. People with OCD don't want to perform these compulsive behaviors and they don't get pleasure from them, but they feel that if they don't do these behaviors, their anxiety will worsen. So they're time consuming and they get in the way of important activities that people with OCD value. Some of the common examples of compulsion include arranging things in a very specific way, like items in your cupboard, or collecting some items that don't have any personal or financial value, like repetitively checking things such as locks and switches and doors, saying certain words while doing unrelated tasks, like constantly seeking reassurance, like constantly checking that you haven't caused someone harm, cleaning or washing hands over and over again. So these are some of the common examples of compulsive behaviors in OCD. So what are the causes of OCD? OCD could be due to genetics, childhood trauma, or panda syndrome. Studies have shown that people who have a first degree relative with OCD, they are at a higher risk of developing this condition, and their risk increases if their relative have developed this condition as a child or teen. The childhood trauma has also been associated with OCD. The childhood trauma may include neglect or abuse. The Panda syndrome is pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. It describes a group of conditions that can affect children who have had strep infections, such as scarlet fever and strep throat, and OCD is one of these conditions. The diagnosis of OCD. There's no specific test for OCD. The healthcare providers use DSM-5, which is Diagnostic and Statistical Manual of Mental Disorders, 5th edition, to diagnose OCD. And the criteria includes that the person should have obsessions and compulsions or both. And these obsessions or compulsions are taking a lot of time, like more than an hour a day, and these obsessions or compulsions are causing distress or affecting your participation in work responsibilities or social activities or other life events. And these symptoms are not caused by any other mental health condition or any other medications or some substances. So this is the criteria of diagnosis of OCD. The treatment of OCD includes psychotherapy and medication. The psychotherapy includes cognitive behavioral therapy, CBT, exposure and response prevention, ERP, and acceptance and commitment therapy, ACT. In cognitive behavioral therapy, a therapist will help you examine and understand your thoughts and emotions, and over several sessions, they can help alter harmful thoughts and stop negative habits, and they will help you in replacing them with healthier ways to cope. In exposure and response prevention, which is also a type of cognitive behavioral therapy, a therapist will expose you to your fear situation or image and will have you resist the urge to perform a compulsion. For example, they will ask you to touch a dirty object, but they will stop you from washing your hands. And by staying in that fear situation, without anything negative happening, you will learn that your anxious thoughts are just thoughts and not necessarily a reality. The acceptance and commitment therapy will help you to learn accept that obsessive thoughts are just thoughts, and they will help you in taking the power away from them. The medications for OCD includes SSRIs, which is selective serotonin reuptake inhibitors. Some of the examples include fluoxetine, fluvoxamine, paroxetine, and sertraline, and they may take up to 8 to 12 weeks to start working. So that's it. Thanks for watching. If you like the video, don't forget to like, share, and subscribe, PharmCept. Thank you.